First of all, thanks to God for the opportunity to share information that will not only help our bodies, but help those that we love and care about. Um, I want to start by saying the Wellness Connection is has been really good and informative as far as our health and wellness is concerned. And because of the Wellness Connection, we heard a lot of good information about the two items that I'm going to talk about this morning. I'm going to first share about Alzheimer's. Um, as a matter of fact, this is uh, Alzheimer's Awareness Month. And you see some of us are wearing purple, and that's the color. October is Alzheimer's Awareness Month. Purple Sunday is sponsored by the Alzheimer's Association in Cleveland, Ohio, and the greater East Ohio area. It was designed to educate members of the faith community and Alzheimer's disease, Alzheimer's disease and other dementias. I'm going to start with a scripture, and that is 1 Corinthians chapter 6, verse 19. And it says, "Don't you realize that your body is the temple of the Holy Spirit who lives in you and was given to you by God? You do not belong to yourself, for God bought you with a high price. So you must honor God with your body." And with that, that means that we need to offer our body as a living sacrifice unto God. And how many of you know if we're not healthy, um, we can't do His will? We can't go out and minister to others if we don't take care of our own bodies. The second thing that I'm going to talk to you about is an update on COVID-19. And that will be very brief. Both of these are pretty brief presentations because I was given a certain amount of time, and I'm going to try to keep that time. But there are you have some handouts, I believe, and then there is more information on the table outside. Okay, how many of you have been impacted by the disease called Alzheimer's or dementia in your family? Someone in your family dealing with it. Most of us have been, even if the person that you experienced some dementia or Alzheimer's with is no longer with us. We have been touched by this in most of our families. How can we change our lifestyles to affect our health? There's a lot of information out there. But one thing is for sure, the way we eat will help us maintain our bodies and avoid some of these illnesses like Alzheimer's that the onset comes about as a result of a lot of times how we treat our bodies, how we feed our bodies, the food we put into our bodies. If we see signs of memory loss in our loved one, let's take action and seek a diagnosis. It is important to start treatment of the disease early. Alzheimer's and dementia disease. Worldwide, 55 million people are living with Alzheimer's and other dementias. Alzheimer's disease is a brain disease that gets worse over time. It's characterized by changes in the brain that lead to deposits of certain abnormal proteins called amyloids that build up in your brain. Alzheimer's causes the brain to shrink over time, and brain cells eventually die. The Alzheimer's disease is a degenerative brain disease and the most common form of dementia. Dementia is an umbrella. There are a lot of different types of dementia, but Alzheimer's appears to be very prevalent now, currently. Um, as I was saying, the most common form of dementia, a gradual decline in memory, thinking, behavioral, and social skills. These changes affect a person's ability to function. This disease is not a part of normal aging, as pastors mentioned before. Dementia is not a specific disease. It is an overall term that describes a group of symptoms. If you can put the slide up that shows the brain. As you can see, I believe a picture is worth 1,000 words. And the brain, the normal brain on my left is, as you can see, the cortex, the sulci, the white matter, all of that looks full and healthy. But on the Alzheimer's brain, you see a deterioration, a shrinking of the ventricles and the other parts that are listed up there. They don't look the same. So I'm going to talk about 10 early signs of Alzheimer's. Let me get my little. And they are memory loss that disrupts daily life. Alzheimer's is a brain disease that causes a slow decline in memory, thinking, and reasoning skills. There are 10 warning signs and symptoms. If you notice any of them, don't ignore them. Schedule an appointment with your doctor. One of the most common signs of Alzheimer's disease, especially in the early stages, is forgetting recently learned information. Others include forgetting important dates, events, asking the same question over and over again. There's another picture, if we can pull that picture up. A healthy brain, you can see a little bit clearer, and a severe Alzheimer's diseased brain. Challenges in planning and solving problems. Some people living with changes in their memory due to Alzheimer's or other dementias may experience changes in their ability to develop and follow a plan or work with numbers. What is a typical age? I'm going to skip through some of this because you have the handout and you can read for yourself. What is the typical age-related change? So it would be normal if you make an occasional error in managing your finances or household bills. But when you have Alzheimer's, you may even forget how to do your bills or when they're due. Changes in planning or solving problems. Some people living with changes in their memory due to Alzheimer's or other dementias may experience changes in their ability to develop and follow a plan or work with numbers. Withdrawal from social activities. A person living with Alzheimer's or other dementias may experience changes in the ability to hold or follow a conversation. So what they do then is they avoid being in the presence of others. What's a typical age-related change? It would be normal, say sometimes feeling uninterested in family or social obligations. We all go through that sometimes. That's normal. But if you're avoiding being in the company of people and engaging in outings, then that may be a sign of lack of wanting to be a part of social activities. Change in mood and personality. Individuals living with Alzheimer's or other dementias may experience mood and personality changes. Um, and a typical uh, development or normal would be developing very specific, they develop very specific ways of doing things. The person who has Alzheimer's may really get agitated if you change what they normally do, whereas we may be able to make the adjustment. Okay? And I have another picture of a brain, and it shows some of the components within the brain that are altered when Alzheimer's set in. Again, on the left, you see that healthy brain. On the right, you see the brain that starts to deteriorate. Alzheimer's disease is a progressive, now I'm going to just state some facts about Alzheimer's disease. It's a progressive fatal brain disease that kills nerve cells and brain tissue. Alzheimer's disease is a most common type of dementia. More than 6 million Americans are living with Alzheimer's, with over 11 million caregivers. 1 in 3 seniors die with Alzheimer's or another type of dementia. Almost 2/3 of Americans with Alzheimer's are women. There's no cure for this disease. Medication may slow down the progress or help in some way, but there is no cure at this time. Once the process starts, it's hard to stop, and you can only slow the progress. In the advanced stages of Alzheimer's, severe loss of brain function can cause dehydration, malnutrition, or infection, which may result in death. And I have some references to where I obtained the information from, and some of them are like the Mayo Clinic and Alzheimer's Navigators, which is an organization that talks and shares information about Alzheimer's to make us all aware of the benefits of getting diagnosed early for Alzheimer's. And I'm going to leave off on Alzheimer's, and are there any questions? If you do have questions, there's a number on the sheet or contact information on the sheet that you can call and ask questions. Of course, I'll be willing to answer questions, but I am not the authority on Alzheimer's. Dr. Smart was one of the guest speakers at one of the health and wellness town hall meetings, and as he is also my husband's doctor, and he really broke down the intricate parts of the Alzheimer's disease and was able to explain the different stages that one would go through. What I remember from my experience as a nurse is being in clinicals with some of the young people and looking at the faces of the people who had Alzheimer's. A lot of them have a blank look. Their family will visit and they don't know really who they are. They recognize that there's someone that they know, but they can't tell their names. So it's a degenerative disease that really needs to be looked at as soon as you see some signs of the disease coming on. Now I'm going to change over to COVID. COVID-19 we're familiar with. Some of the information about what it is, I'm going to skip over that information. I have about 3 or 4 points that say what COVID is. I'm going to skip through that and go to the possible symptoms and what they include. If you can go to that slide. Okay. Uh, Fever or chills, cough, shortness of breath, or difficulty breathing, fatigue, muscle or body aches, new loss of taste or smell, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. This list contains uh, more symptoms than we learned about initially when COVID first started to come about. This list does not include all the possible symptoms. Symptoms may change with new COVID variations and can vary depending on vaccination status. CDC will continue to update this list as they learn more about COVID-19. Adults and older adults and people who have underlying medical condition like heart or lung disease or diabetes are at higher risk for getting very sick with COVID-19. If you are feeling sick or experiencing any symptoms, consider following the following option. First of all, get tested. If you have already tested positive for COVID-19, refer to the CDC's isolation guidance. People with COVID-19 should isolate for 5 days. And if they are asymptomatic, that means no symptoms, or their symptoms are resolving without fever for 24 hours, follow that by 5 days of wearing a mask. I still have my mask. When around others to minimize the risk of infecting people you may encounter. The CDC guidelines change is motivated by science, demonstrating that the majority of the SARS-CoV-2 transmission occurs early. In other words, COVID-19 transmission occurs early in the course of illness, generally in 1 to 2 days prior to the onset of symptoms, the 2 to 3 days after, and 2 to 3 days after. Additionally, the CDC is continuing to update the recommended quarantine period. Anyone in the general public who is exposed to COVID-19 must quarantine at least who are exposed to the COVID-19, you have to quarantine, and you know you were exposed, quarantine for at least 10 days wearing a mask because you're not sure whether you have it or not. So you want to quarantine just to make sure if you know that you were exposed. Alternatively, if a 5-day quarantine is not feasible after you have contracted COVID-19, if you can't quarantine for 5 days, it is imperative that an exposed person wears a well-fitting mask at all times. For all those exposed, best practices would also include a test after exposure. If symptoms occur, individuals should immediately quarantine until a negative test has been confirmed. And those are some of the points about COVID. And these few things right here are what you need to know. If you have COVID-19 and are more likely to get very sick from COVID, treatments are available. Don't delay. Other medications can help reduce symptoms and help you manage your illness, manage the illness. The treatment locator at hhs.gov can help you find a location that offers testing and treatment, or a pharmacy where you can fill your prescriptions. You can learn more about what to do if you are sick at that hhs.gov location or website. When to seek emergency medical attention. Look for the warning signs for COVID-19: trouble breathing, persistent pain or pressure in the chest, new confusion, the inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nails, depending on your skin tone. If someone is showing any of these signs, call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. The FDA has authorized or approved several antiviral medications to help when you have contracted COVID, and especially for those who are immunocompromised or have an underlying condition. There are medicines that keep you out of the hospital or keep you from getting seriously sick. That's all that I have to share on Alzheimer's and on COVID-19. Let's stay healthy and stay vigilant about our bodies and our health and taking care during this winter season. Thank you.